Doctors have described dire scenes at Harare's two main state hospitals. Doctors and nurses have been striking intermittently over the last few weeks. Authorities are clamping down on dissent there. So where does this leave citizens hoping for decent medical care during the COVID-19 pandemic? MSF, or Doctors Without Borders, has been helping there. Dr. Reinaldo Ortuno is the head of mission for MSF in Harare. Dr. Ortuno, good evening to you. Thank you very much indeed for your time tonight. What is the situation like there for the people you're trying to help?
Yeah, good evening. Thank you so much. Yeah, the situation in Zimbabwe now, it is worrying because the number of cases are increasing and the local transmission is higher. In the last week, we have seen an average of 100 to 150 new cases per day. So despite all the measures imposed in the lockdown, there is still people not compliant with the recommendations. So there is no physical distance that is maintained, masks are not worn properly. And it remains very important to continue doing sensitization in the community and to increase the testing capacities in the country to be able to detect earlier infected people, and so they can be isolated and prevent the spread for the disease.
And for the people who are being isolated, the people who are being treated for, what are the conditions like?
Currently, we know that there is some facilities that are almost completely set up, Wilkins Hospital and here IDH. But we know that because of the strike of the nurses and the senior doctors, they are lacking human resources. So it remains a challenge for the patients, for sure, that needs to be taken care, particularly the ones having severe conditions. There is a Parianyata hospital that is working currently, and they are admitting patients. But indeed, in terms of equipment and the resources, it is still a challenge.
And then water is also a problem. There have been big issues with water in Harare. How's that affecting you?
We as MSF, we are working in Harare, in Zimbabwe for over 10 years, and we have adapted our activities and protocols for COVID-19 prevention to continue offering access to care for our supported programs. Particularly, we have a program for non-communicable diseases, which is mainly diabetes and hypertension, adolescent sexual reproductive health, cervical cancer activities, and care for migrants, where we have increased our health education, how to protect themselves, and longer refills and teleconsultation. For COVID-19, we have trained as well MOH staff in the different locations for clinical management and infection prevention control. And we as well supported community sensitization and health education, provided non-medical masks for population on higher risk. And we as well have supported in screening and referral units for COVID-19 in the places where we are working. Additionally to that, we have supported with nurses and hygienists in the isolation center in Wilkins Hospital and in the National Reference Laboratory with the rapid response team as well working for surveillance.
It's such a difficult situation in Zimbabwe, politically very difficult. There are people who don't have enough food as well. Are people taking COVID-19 seriously enough, considering the other problems they face?
Can you please repeat the question?
Are people taking this crisis seriously in Zimbabwe? Are they taking the disease seriously?
It is a challenge indeed. People, I think, need to still be sensitized because it is not really respecting the measures for infection prevention. There is no real physical distancing. We saw some crowded areas in Harare, particularly, where big markets are still open and people is not really having any physical distancing among themselves. They are not using masks properly, and it remains a challenge for transmission. And we see an increase of local transmission currently ongoing that could be a higher peak later on coming. We see that there is some estimation that are projecting some peak for Zimbabwe for October, November. So I think we are going to head towards this in the coming future.